السلام عليكم دكتور. نرحب
عليكم السلام.
بالحضور، نرحب بالدكتور عادل الملوكي. دكتور
شكرا.
عادل الملوكي أستاذ مساعد في جراحة المسالك البولية بكلية الطب بالعيون جامعة ابن زهر المغرب، وهو رئيس مركز المحاكاة العيون في المغرب. جراح في المسالك البولية وأخصائي أمراض الذكورة والجراحة. خريج جامعة محمد السادس للعلوم الاجتماعية الدار البيضاء في دولة المغرب في مجال المحاكاة والتربية والرعاية الصحية. نرحب بك دكتور عادل ملوكي معنا في المملكة العربية السعودية في ورش عمل جمعية السعودية للمحاكاة، ونرحب بك في التوبيك اللي أنت بتقدمه عن تدريب المدربين في مجال التعليم الصحي في تخصص المحاكاة والتعليم بواسطة المحاكاة. أهلا وسهلا بك دكتور، ونرحب بالحضور الكرام ومرحبا بكم. تقدر تتفضل يا دكتور وتبدأ.
شكرا جزيلا على الاستضافة. أنا بدوري تنشكر جميع العاملين في قطاع المحاكاة الطبية بالمملكة السعودية، اللي هي مملكة صديقة على بلدنا المغرب. وشكرا للجمعية السعودية للمحاكاة على الاستضافة. So good afternoon, everyone. I'm deeply honored to be today at the Simulation Week 2024, organized by the esteemed Society of Saudi Society of Simulation in Healthcare. I would like to extend my heartfelt thanks to the head of the society, Prof. Abdel Al-Tassi, for inviting me to be part of this significant gathering of experts and pioneers in healthcare simulation to talk about a preeminent topic. It's the training of trainers for healthcare simulation education. So I would like also to express my gratitude to my institution under the leadership of our dean, whose continuously support has been critical in driving forward our endeavors in healthcare simulation. A special thanks also to Professor Mohammed Mohawi, the president of the Moroccan Society of Healthcare Simulation, who has been both a mentor and a source of inspiration in this journey. A special thanks also goes to Mrs. Nora for her constant communication and support. Okay, they told me that the sound isn't so well. Is it good now? Hello?
دكتور عادل لو تستخدم السماعة يكون أفضل عشان الصدى.
Okay, I have to switch to another computer. The sound is not. It's not. You're not hearing me well.
بنسمع بصدى.
Okay. I will try to do my best so as the sound will be better. Okay. Thank you. So, as cited in the presentation, my name is Adil Mellouki. I'm Assistant Professor of Urology, graduated in Healthcare Simulation from Casablanca, and I'm Assistant Professor at the Faculty of Medicine and Pharmacy of Lyon and head of Lyon Simulation Center. So here is my faculty and a quick view of my city, Lyon, in the southern province in Morocco. It's a proud representative of Lyon, a city located in a promising southern region of the Kingdom of Morocco. I would like to take a moment to highlight the rich culture and heritage of my homeland. Known of its warmth and hospitality, Lyon embodies the essence of our country's diversity and culture. So the presentation is about training of the trainers of healthcare simulation education. We are facing a growing need to enhance the quality of simulation-based training in healthcare institutions. We're going to highlight the importance of a topic, how we can set the key components of a comprehensive program, and how to ensure a high-quality simulation-based training benchmark. So I will start the presentation now. So as we all know, simulation-based training has proven effectiveness in improving clinical skills, teamwork, and patient safety. We are facing a rapid growth and spread of simulation-based education in healthcare. So we have an increasing demand for qualified trainers, instructors who can deliver high-quality simulation-based training. The aim of the presentation is to address the need for a comprehensive training of trainers program to elevate the quality, consistency, ensure a dissemination of simulation-based education in healthcare institutions. Why do we need a TOT program in healthcare simulation? What the evidence says? So we know that there is a lot of challenges in the current landscape. There is a lack of standardized curricula and varying trainer competency across simulation centers. There is a shift from traditional training method to simulation-based education that's required skilled trainers, high qualified trainers that improve simulation-based training outcomes. So we need to standardize TOT program, which can significantly reduce the variability in training quality. TOT program, it's not only in healthcare. So here we can see that also in other fields, aviation, football, and nuclear activity as example for the need to train the trainers so as we can reach high quality outcomes of the field that we gonna have. There is a lot of impacts and benefits of TOT program in simulation centers. So there is an enhancement of instructional quality, so we can improve educator competence, lead to better learner engagement and knowledge retention. There is a data that shows that effective TOT program results in consistent learner outcomes, reduced medical error, and improved patient safety. There is also organizational benefits. So in your organization, you can increase capability of simulation center to achieve and maintain accreditation process from recognized organizations, ensuring that institutions meet high quality benchmarks. There is, of course, challenges and opportunity in the field. So the challenges are that there is a lack of resource allocation, resistance to change among faculty, and the cost of high-quality simulation tools. And there is a necessity to address the diversity of educational needs and background among trainers. The opportunities is that with a comprehensive TOT program, we can benefit of technological advancements, example, artificial intelligence, virtual reality, and augmented reality to enhance trainer engagement and enthusiasm. There is an opportunity for collaborative network and partnership between healthcare institutions to share best practice and resources. So what the scientific society says about the recommendation and best practice for effective TOT implementation, the key strategies for success is to, it should be implemented in a continuous professional development program through regular TOT refresher course and advanced workshops, ensuring alignment with national and international standards, such as those from SSSH, the Society of Simulation Healthcare, and the SOFAR SIM to maintain quality and consistency of the program. We need to ensure that we meet high quality measures, so with regular feedback loops, peer review, outcomes evaluation to maintain and elevate instructional standards. So now we gonna see how in Morocco we've dealt with the TOT journey. So the Morocco SIM TOT journey, how it started. In the first picture here, we have the first masterclass led by the peers from the Descartes Paris team for Moroccan teachers on June 2011, and the Faculty of in the Faculty of Medicine of Casablanca. So then this group who've been teaching has organized a 100% first masterclass with Moroccan faculty at Marrakesh in 2015. And the very first graduation class of the university diploma in health simulation is in Casablanca in 2018. So my promotion is the promotion of simulation in healthcare diploma in 2023. So now the Morocco SIM is a huge network. So it is disseminated in all over the kingdom. And we have more than 8 healthcare simulation centers certified in Casablanca, Rabat, Fes, Marrakesh, Oujda, Tanger, Agadir, and Laayoune. And it's held under the umbrella of the Morocco SIM Society, which held more than 1,200 members and more than 300 graduate simulationists. The main activities is to organize the train of trainers activity, the university diploma workshops all over the year, masterclass, webinar, online content for the trainer and also for the students, and the annual congress. In the Faculty of Medicine of Laayoune, we are a young faculty. It started 4 years ago, and we have organized the first ever training of trainers session with Professor Mohawi. He is our simulation hero. Not all heroes wear a cap, and he is one of the simulation heroes in Morocco. So we have organized this masterclass, and with this masterclass, we have reached a high level of satisfaction from novice simulation novice teacher, and an engagement and the possibility of networking, and also the ability to get involved in university diploma or advanced workshops in healthcare simulation. So there are two main types of TOT in simulation. There is short course and long courses, which is the guideline. This is the guidelines of the SOFR-SIM, which is the Society of Francophone for Healthcare Simulation, which give guidelines to how we can standardize the practice of short TOT program in order to improve quality of the learning. So who is the trainer? Or regular medical or non-medical must have specific training in simulation university degree, officially recognized training notably by the relevant National Professional Council, including training aboard, internship, short courses, suitable for their involvement in simulation training and the type of infrastructure. Or alternatively, a validation of experience recognized by the head of the infrastructure and or the educational and or scientific leader. They must have teaching and pedagogical experience in the subject to be taught, as well as specific skills in behavior analysis or risk management necessary according to the proposed simulation program. So now we're going to see the main outlines of the TOT short program. The basic skills of, we're going to see, first of all, the basic skills of initial training of instructor, and then advanced skills for continuing education. Excuse me. So for the TOT short program, the short program is defined by a program that do not allow for the immediate acquisition of skills, but enable the acquisition of knowledge necessary for the gradual learning of skills through supervised practice, particularly by more experienced trainers. As recommended by the SSSH, it's required a structured and evidence-based approach. The first step is to define clear objectives that align with the need of both the trainer and learners. The SSSH also emphasizes that a TOT program should focus on developing both pedagogical and technical skills. This includes understanding adult learning theories, mastering simulation modalities, and utilizing debriefing techniques. Trainer must also be familiar with various simulation scenarios, ranging from low fidelity mapping and to high fidelity simulation, to adapt their teaching to different clinical environments and learning objectives. The program should begin with the need assessment to tailor content to the specific educational context of the trainers. So the framework is in three main steps. The first step is the pre-program organization. So we have to send simulation reference and support to the trainer. We have to do a pre-test. Then the program, we have to set the duration of the session, theoretical part, practical part, and trainer to trainee ratio. Then in the post-program, we have to do the post-test, the evaluation of the training, and maybe we can need also practical internship. It depends on the objective of the training. In the pre-program part, we have to send simulation reference to the training. So this simulation might be a guide to best practice in healthcare simulation, one or more example of evaluation tools for debriefing, example debriefing assessment for simulation in healthcare to guide the continuing professional developments. The pretest, the purpose of this pretest is to guide learner toward the training objectives and to assess the learner knowledge. Trainers will be able to offer multiple choice questions, short open-ended question, or an assessment of self-efficacy before the training. At the end of this step, we can then pass to the main step, which is the program. The duration of short training course should be tailored to the number of participants, the number of the trainees, and the objective, the content of the training. The possibility of working in subgroup to enhance personal work, interaction, and execution of practical exercise. The duration of a short training course can range from 3 to 5 days. The theoretical part is preeminent and cornerstone of the program, which is defined by the educational objective. Depending on the objective of the trainer training in simulation, various teaching methods can be used with, for example, lectures, inverse classroom, digital tools, quizzes, workshops, series game, and so on. For the practical part, this part must correspond to a minimum percentage of the total training time, at least 33%. During this practical session, the future trainer must experience the role of supporting actors, active learner, and observer during the simulation, as well as debrief at least once. At the end of the role-playing scenarios and feedback session, he will be offered by the trainer, highlighting the positive aspects and area of improvements. So for the trainer-trainee ratio, as high as possible, a high trainer-to-participant ratio fosters interactions, psychological safety, and opportunity to experiment with different position situations. A ratio of 1 trainer for every 6 trainee enhances interactions, especially during group work. For the post-program, at the end of the training, a post-test is mandatory. It will be corrected at the end of the training to assess the learner's knowledge after the training. This post-test will be theoretical. So it will be identical to the pre-test and will allow for an assessment of the trainer's knowledge progression. Then we have to evaluate the training by trainee at the end of the training. At the post-program, a self-assessment of the trainer's level can be conducted at the end of the session. It will cover all the learnings. This will differentiate between the briefing, the simulation, and the debriefing. It will follow the general goals of learning assessment by integrating the first 3 levels of the Kirkpatrick model. The level 1 is the reaction regarding the training. Level 2, the perception, and level 3, impact of this training on their future practice. A follow-up of the learners can be offered at the end of the training. This follow-up may consist of a day of session with the support of at least 1 experienced trainer. The follow-up may be limited to occasional advice. A second evaluation conducted remotely after the training is recommended and even mandatory in some French-speaking countries. After the training, we can personalize the action to plan, and this personalized action may include a practical internship in a simulation institution, but it's not mandatory. Are you following? Is the sound okay now? So we're going to continue. So the educational objective of TOT short program, we have 5 essential topics. So the structure of a simulation session, simulation programs, non-technical skills, the role of simulation in education and pedagogy, and the awareness about difficult debriefings. The main objective to reach are pedagogical skills, simulation skills, debriefing skills, and clinical skills. The main topics are the risk management in health and medical errors. The trainee must know how to deal with medical errors and learn the James Reason model. Non-technical skills in medicine and in simulation. Simulation structures, the definition and interest, and then the limitation of simulation. Description of simulation tools, the concept of fidelity in simulation, and the importance of training the trainers in simulation. Other topics are pedagogy and simulation in healthcare, implementation of a healthcare simulation program, simulation session, scenario simulation, the place of the facilitator and patients, the standardized patients, principle of programming in simulation, and pre-briefing and briefing. One of the most important topics is the debriefing. As we say, that all we do in the simulation is just a reason to perform the debriefing in the end of the session. It is important to be aware of the possibility of difficult debriefing. Then other topics are formative assessment of learners, summative assessment and in simulation, ethics in simulation, interest in video and programming and the right to image in the simulation, And then the trainee must know the field of research possible in simulation. So now we have to know who is the trainer of trainers in simulation. What is the curriculum of instructor delivering TOT short program? So the trainer must be a holder of a university degree in simulation or pedagogy. He must participate in a minimum of 2 health simulation the trainer session per year, and the trainer who conduct short training session must practice at least 6 health simulation sessions per year. And then, very important, he must be evaluated by self-assessment using the DASH grill, evaluation by a trainee or by an external trainer, particularly through DASH. What we expect of the trainer in TOT program. So the TOT workshop can build a pool of competent instructors who can then teach the material to other people. So as we can disseminate the simulation-based education in our institution, even with simulation novice teacher. Then he will direct the participants to supplementary resource and reference material, lead discussions and lead activities that reinforce learning, listen effectively, and help instructors to be more effective in their practice and more responsive to the need of the learners they serve. He should make observation, provide insights into how adults learn, and can help instructors to be more effective in their practice. And finally, he should support participants, provide completed, continued, and targeted follow-up support once a professional development event has been completed. So after seeing the basic skills of initial skills for training of trainers program, we will see an advanced skills for continuing education. The educational objective for advanced skills for continuing education of a trainer is to master debriefing skills, the impact of human factor in simulation, be effective in risk management in health with the crisis resource management, the management of a simulation center, training in and evaluation procedures, medical knowledge, new developments in educational innovation in simulation, and be aware of the process of accreditation of their simulation center. How to stay up to date with the advancements. So a lot of possibility. The learner can use lectures, books, e-books, and e-learning platform, attend congresses, be aware of the up-to-date recommendation from scientific society, organize thematic days among peers, and attend masterclass, workshops, and webinars. The trainer portfolio is an effective way to organize his own learning journey. In pedagogy, in health simulation, as in medicine, the half-life of information is short, and trainee must receive regular and substantial information regarding their development and progress. Even professional expertise, which is the highest level of professional competence, like other levels of professional skills, can only be maintained and developed through a specific, conscientious, and deliberate practice explicitly aimed at learning, which is referred to as an intentional practice, deliberate practice. It is essential to have a common tool that allows for the presentation of the trainer initial training, their participation in continuing education activities, their pedagogical activities, their research activity, and their publication. So how we can develop a portfolio framework? To create a personal learning portfolio, a trainer should maintain a portfolio that tracks their continuous professional development journey. The portfolio will document their learnings, reflection, and achievements over time. The main sections of the portfolio are the personal information and the CV. Then we can track courses participation, where we can record all refresher and advanced course attended, including dates, course details, and certification earned. Learning reflection, personal reflection on what was learned in each course, how it applies to practice, and area for further developments. Skills assessment include self-assessment, peer reviews, and formal assessment of skills. Goals of and planning, a section for setting short and long-term professional goals with and focus on continuous improvements. So, in conclusion, the TOT, the Training of Trainer program, is a must and the cornerstone asset in simulation-based education. Comprehensive training of trainers program enhance the quality, consistency, ensure the dissemination of simulation-based training in healthcare institutions. There is an urgent call to action for institutions to invest in comprehensive training of trainer program to improve training outcomes and patient safety. This is an era of ongoing innovations, so there is future research and innovation in TOT methodologies are mandatory to continue advancing these preeminent fields in healthcare simulation. So this is the end of my presentation. Now we can open the discussion if we have some question about our experience here in Morocco with the TOT program, and you can also share your insights about the subject. Thank you very much.
Thank you, Dr. Adil, the participant for your lectures, and really it's good lectures and interesting. I would like to ask the participants, there is any question, please start.
Thank you very much.
There is no questions in the participants.
You talk about the learners. How to be an instructor? He will show most of the course director for the general healthcare programs. And they have the most problem with them. It's how to write the objective and how to create a scenarios, or how I'm gonna to start. This most of the question when they met the expert doctor, they are asking about it. Even they take TOT, essential skill for trainer. Did you think in the essential skill for the trainer or it depends to the college or depends to the specific college or the objective? This is my question. Why we can do a specific TOT for each healthcare specialist?
Thank you for the important question. And if I have heard you well, the question is about how we can choose the objectives of the TOT program and how we can tailor the objectives for the profile of the learner. So I will give you insights about the first experience here in my faculty in Lyon. So we are about 15 assistant professor, and we are two or three to have been graduated in simulation degree, university degree of simulation and pedagogy. So all the others were novice in the simulation fields. So with the help and the continuous help of the president of the Moroccan Society, Professor Mouhawi, we have organized the first masterclass of training the trainers. And we have choose the basic objectives, which was what is the simulation-based learning, how it can help to attain best outcomes with the learners, how we can engage more possibilities in the learning objectives, and then how it can help to the transmission of the knowledge will be better and attain the main objective, which is patient safety. So for the first TOT session, we have chosen just the basic objective, which is the structure of a simulation session. What is the simulation? What's the importance of non-technical skills in simulation and the role of simulation in education? And the structure of simulation session, which is the briefing, the scenario, and then the debriefing. Then at the end of the session, a lot of the trainers asked about complementary session to master their skills and the knowledge they've learned in these basic courses with advanced skills in the topic. So they asked about more session to master debriefing and the difficult debriefing, and to be more best in practicing the scenarios. So it depends on the profile of your institution and the vision of the institution, and also the faculty who is involved in your department. I wish I've responded to your question.
Yes.
Thank you.
I have another question about you mentioned about the train the trainer. There is a long course and there is a short course. How I gonna to catch what did I need? What did I need? Sometimes when I participate in this course, for example, how come I choose between this long, I need long or short, depends on what, for what?
I got you. Okay, so the main scientific societies and the simulation center who can deliver TOT program are sharing before the TOT program the technical support for the program, and in this support you can see the objective which is already seated in this technical support. So you can choose the TOT program depending on what you want to learn, and it is also the role of the pretest. So we can know what are the profile of the trainer who will be in this program, and so as we can adjust the objective depending on the profile of the trainer. If we have a novice, simulation novice trainers, so trainees, so we can choose the basic objectives, and then if we have most advanced trainee, so we need to maybe talk about advanced skills and for example, research in simulations, how we can manage crisis resource management, how we can manage the medical error, how we can manage difficult debriefings.
Clear. Any question from the participant?
Can I see the room where there are the participants or not?
Yeah, it's 28 participants.
So thank you very much for inviting us and the Morocco delegates for in your very your excellent congress, and wish to see you in our congress in February next year here in Morocco, so as we can entertain the links between the scientific societies. Thank you very much.
Dr. Adil?
Yes?
And there is in the chat, there is one question, it's written, what's the challenges have you indicated when the integrate the simulation into the TOT?
Excuse me, I didn't hear you well. If you can repeat or
the question about the challenges for integrate the simulation in the TOT.
Not hearing you. Can you please write the question in the chat bot?
The mean of the question, the mean of the question is when I integrate the simulation in the trainer, there is a different type of train the trainer in the educations. So when I involve the simulation in TOT, what's supposed to be I achieve? The challenges.
The question was how to integrate simulation in TOT program.
The challenges you faced in the TOT.
Difficulties we have faced. What challenge? Okay,
Yeah.
okay. Okay, so the principal challenges in for a TOT program, as we cited here, is that we have the simulation-based learning is it's a new methodology for healthcare education. So there is not all the teachers in the medicine faculties or nurses institution who is aware about this methodology and this field of education. So one of the challenges is the resource allocation in your simulation center. there is you can face resistance to change among faculty. So you can face a type of teacher who will tell you what's the simulation-based learning can change in my practice. I am very good with what I did. And once he can attend the TOT program, you will see that he will change his mind and want to get involved in more session to entertain his knowledge. For TOT program, I can't see that I cannot say that there is a cost-effective, highly costly, but once we can organize a TOT program with just classroom and slideshow and a trainer. It's a very cost-effective modality for the simulation of healthcare simulation. So the main, also another challenge is the diversity in TOT program, even in the same country and in the same city. There is a need to standardize the educational needs and to standardize the TOT program, so we can do an homogenization or do a standardization of objectives to be learned in the basic TOT program and in the advanced one. And every trainee must go through all the steps to get involved in simulation-based learning, effective one, to help his institution to get quality assurance, high-quality benchmarks, and to get to be ready for accreditation process. Wish I've responded to your question. Thank you very much.
I would like to thank you, Dr. Adil, about the interesting topic. Thank you to join us in the program of Simulation Society. In Simulation Week, it was very interesting topic, and most the healthcare providers, they need to know about more about the essential skill of train the trainer. And really, thank you so much for your lectures. Thank you for the participant to attend this course. Please please look for our schedule in Saudi in Simulation Society. We have interesting topic for whole week. Thank you so much for joining us.
Thank you very much. Thank you. It was an honor for me. Thank you.
Thank you so much.